Good afternoon, everybody. And in today's Doctor Speak series, we have with us our guest speaker, Dr. Rajni Sunkar. Before we get to discussing with ma'am a very relevant topic, a health topic in today's world, we'll just let you know a bit about what we are doing and what is our effort at NatureFit. NatureFit is your Ayush digital platform. It is available as a mobile app as well as a website as well, where you can connect with the Ayush doctors and practitioners. You can take a consultation with them. You can also buy Ayush products. So, Ayush standing for Ayurveda, Yoga, Homeopathy, Naturopathy. So, all these therapies where we can help you get treated in a natural, in a healthy way is what is NatureFit offering to all of you. In NatureFit, we have a lot of doctors who are associated with us, and on a weekly basis, we connect with one of our doctors and we try to understand a health concern and how Ayurveda can actually help in healing that. So today's guest speaker with us is Dr. Rajni Sunkar. Dr. Rajni Sunkar is the director of Yashayu Multi-Specialty Ayurveda and Panchakarma Center. She has 12 years of experience in the field of Ayurveda. She practices in Bangalore. She's also done her fellowship in cosmetology, trichology, and skin aesthetics. She is specialized in Panchakarma, eye, ENT diseases, cosmetology, skin and hair diseases. She treats lifestyle disorders like obesity, diabetes, and its complications. Also, diseases like infertility and many, many more. So, I think one stop for everything that we can think of as a disease today is what ma'am treats. She is also awarded with accolades, many accolades, like Dhanvantri Award, the Real Superwoman 2022. So we welcome you, ma'am, for today's podcast. And today's topic is very, very, as I said, very relevant for everybody around. It is the eye strain solutions for working professionals. So let's get started with our first question on that. What are the common causes of eye strain among the working professionals?
Thank you, Amniji, for giving me a wonderful intro. And it's been a very good association with NatureFit, as I believe there is a need for people to have one-stop solution for all Ayush needs now. And thank you once again. And when it comes to the subject, as ma'am said, it's regarding eye strain. So when we want to understand what is eye strain, so why it happens? Every now and then, the working professionals, maybe IT one or the people who are working for a desk job, or these days the youths who are already exposed for many gadgets and laptops, whatever the reason could be in the profession, everyone are complaining of eye strain now. When we complain of eye strain, the patients complain with a history of ocular pain. It is an eyeball pain. They feel discomfort, they feel irritation. Sometimes they feel that my eyes are very fatigued and I'm unable to see clearly. There will be double vision sometimes. They will complain of history of persistent headache. So when these complaint comes, usually they neglect. Usually they neglect because it's not a concern for them, because eye is least bothered for the youths or the working professions. We have to take a call on this and think why the eyes are getting strained, because we know we are constantly exposed, no matter what the profession is, into the digital media now. Okay, so when eyes are getting fatigued, there could be some reason associated with normal eye strain, or there are some predisposing symptoms which gives clarity that eye strain is coming with some history of some disease. Either it could be of meibomial gland dysfunction, which are the glands associated over the upper and lower eyelids, or sometimes what we say is dry eye syndrome, a computer vision syndrome, because most of the working professions are constantly seeing the blue rays, which has its own effect on the retinal vessels and on the brain. And it could be a reason of refractive errors, because people will be complaining of either far vision or near vision, or sometimes there will be a double vision. These are the history where we see these diseases are giving some ray of a symptom called eye strain.
Right. So, and as we, we all are working, I think now the entire youth, the millennials and everybody, not even the people who are working, but people who are studying also, the youngsters also, everything has now gone so digital for them that
Yes.
they can't actually evade not being on the screen. And one statistic that we have is that the average amount of time a person is spending on the screen today in India is almost 7 hours, 7.5 hours. So
Absolutely,
it's
absolutely.
so I'm sure this is going to be soon like a pandemic where everybody is going to, have this problem. So
Yeah.
yeah, can you suggest some practical tips and exercise to reduce eye strain during long hours of computer work?
Yeah, before taking up this question, let me give some causes of eye strain. Why does eye strain happens in the millennials, especially? These complaints are by the working professionals. So the causes could be a persistent visualization of the blue rays or a wrong posture of the computer to the area where we are sitting. And there could be a dim light where you are not associating with the clarity of brightness, or your screen could be either high bright or it could be a low bright where you're not maintaining the clarity of the screen, or it could be of ergonomic change. Okay, for your comfort zone you are using the gadgets according to your satisfaction. That could lead into a pain of eyeball or some radiating pain which goes to the ear, and sometimes the neck and back vessels also they'll tell about the pain, and some headaches also. So the causes are long usage. Long usage comes with the brightness or over usage of the gadgets, or it could be of wrong usage of the spectacles. If their vision is very normal, yet they are using with the power which is not recommended. So these things could be a reason of eye strain. And when we are looking into eye strain, we have some, when we consider this into a conventional system, the eye strain will feel that eyes are getting fatigued, and some videos will pop up saying that you use an anti-glare glass, so it will subside the eye strain. And some lubricants, OTC, over the counter lubricants will be available, will try to use it. Still then the history continues with the eye strain. Then what comes? There is a need of an ophthalmologist. Eye intervention is necessary. What is the reason I'm suffering? Why there is an intervention of ophthalmologist? Then we'll evaluate the disease and give which is recommended. Either we go with the therapies, or sometimes we give some of the lubricants which are soothing yet not causing any harmful things. And we provide some exercise also, where we can come out of this eye strain, and the prognosis is very good of this disease. Okay, because it is called asthenopia. Eye disease, eye strain is asthenopia. So we don't want to give direct treatment for them. We'll tell them, you follow some of the eye exercise, either hot compressions, where you can just close your eyes, keep on hot gauze piece, and either you can do with that, or else you can go with the eye massaging. Usually in Ayurveda, we prescribe desi ghee, okay, where you can just gently massage on the closed eyelid and do it for 4-5 minutes of the massage, and then wipe it off. Or else you can plan with the eye exercise. Okay, eye exercise are very good soothness because it induces good tear film mechanism, and it lubricates the tear film. And eyelid swelling will be a common symptom in heaviness or a fatigue or a eyelid thickness. It will be a common symptom in eye strain. So we'll gently tell them to massage the upper eyelid and avert it, so that you will come to a conclusion that you are reducing the pain which is associated in and around the orbit. Okay. Or else you can do a Padabhyanga. Padabhyanga is beautifully explained in Ayurveda, where you are doing a massage for the feet. What is the reason of doing massage to the feet? Because we have two nadis connected to the feet called Ida and Pingala. Okay, in Ayurveda, what we say. So those two nerves, when we gently massage for the feet, it gives clarity for your vision. So your eye health will improve. Either you can take a Brahmi oil, which is readily available in Ayurveda market, or else you can use a plain desi ghee, or else you can go with the almond oil, okay, which is rich of vitamins. So you have to do a gentle eye massage, but this eye massages, hot compressors, lubricants, are the basic steps where you can come out of the eye strain. And one more for working professionals, the take home what I want to give is 20-20-20 rule is there. So these 320s, what it indicates is every 20 minutes, because working professionals constantly visualizing the computer.
Yes.
Every 20 minutes, they have to take a break of 20 seconds. Okay. And they, with a 20 feet distance, they have to do some neck exercise, some warm-up exercise. They have to get up from their bed and start doing the eye compresses. So just rub the palm and keep on the closed eyelids. That increases the tear mechanism. Start blinking your eyes for 20 reps.
Right.
And wash it with the cold water and sit. Because the reason of using cold water is eye is a seat of pitta. Everybody knows the words of Ayurveda now, Vata, Pitta, Kapha. These three doshas. Because nowhere it is reverse science now. It is already open up because three doshas are there in Ayurveda. And Pitta is the site of eye. So when we do all these things, it enhances the mechanism of eye and it gives a lustrous vision. So there won't be any eye strain or dryness associated with that.
Right. Okay, perfect. I think very important, which I feel Ayurveda always teaches, is not just give the medication or the treatment, but also teaches you things which you can continue as a lifestyle. So, after the treatment that people have to take, then they have to just do some bits, like you just said, that the 20-20-20 rule. Like if people
Yes.
do, then they will never get this issue again. So I think that's the best thing about Ayurveda, that they not only treat you, but they teach you that how to not get a disease again. So I think that healthy living is what we learn.
Yeah, Ayurveda definitions we have to incorporate preventive and curative.
Yes,
So
yes.
Nidana Parivarjana, they say Nidana Parivarjana is nothing but the cause only we have to eradicate.
Right.
Why we are not treating the cause and landing in these health issues? So we
Right.
can prevent this by doing simple techniques which are easily available around us.
Yes.
So once we do this and adapt it, then there is no concept of any disease suffering.
Right. And like basic things like desi ghee and all are so useful, not only just for in our food as a food item, but also for, as you rightly said, just massaging the eyes with that. Even when I had sinus, I was instructed to put desi ghee into my a little bit nasya also. So that's also so nice, and like we can just use whatever is in our kitchen as well to just
Yes.
keep ourselves healthy in a different way. So,
Absolutely.
yeah, so very, very nice and very enlightening for us to hear that. How does Ayurveda approach eye strain problems? So you have given us certain practical, day-to-day things that we need to do. But what is the Ayurveda's approach towards this problem?
So Ayurveda, when we consider it, is a science of life. The way how we want to lead life, it incorporates all the necessity equipments which has been given naturally through the nature. And the science is so therapeutic that it is easily available in your nature itself. Okay. So Ayurveda, when we consider, there are two strands of the Ayurveda. One is prevention, another is curative. Okay. When we say a prevention, Nidana Parivarjana is a basic thing. We have to treat the cause and eradicate the cause. When it is curative, we have many treatments. What is the disease and how we want to diagnose it says about the three pillars of Ayurveda. We have to consider our dosha, okay, Panchamahabhuta, what is the nature saying, what season we are into, and what is our body prototype. Depending on that, Ayurveda therapies are divided into Panchakarma, and in specific Ayurvedic ophthalmology, they have dealt about Kriya Kalpas. Kriya Kalpas are the specific eye modality treatments which are done over the eye. So these therapies are beautifully incorporated in the strand of Kriya Kalpa. So when we do a concept is there, like we have a separate set of treatments like Seka, Ashtotana is there, Pindi is there. Seka is nothing but pouring the decoction, herbal decoction, which are disease specific over the closed eyelid. We have Ashtotana therapy, where we are putting the medicated, instilling the medicated drops inside the eye, depending on the disease specific. We have some Lepa Chikitsa called as Pindi. We incorporate by mixing the herbal paste over the closed eyelid. Then comes the beautiful thing where people nowadays, they want to try it and they see so many digital channels and they'll come and ask, Madam, I want to undergo the Tarpana. Tarpana is creating a well with the wheat or urad atta, and we instill the desi ghee or a specific disease concerned lipids are there, ghees are there, where we make the eye to dip into that and we'll tell them to blink the eyelid for stipulated time. It is not done for a longer time, but we have to do all these therapies under the guidance of Ayurvedic ophthalmologist itself. So these modalities are explained by Ayurveda. So before going into Kriya Kalpa, we have cleansing treatments called Ayurveda Panchakarmas. Disease specific, we'll be doing a Virechana, as eyes are a seat of Pitta. We do a Virechana treatment. We do Shirodhara if at all the client needs the diseases, if they are suffering with refractive errors like short sight, long sight called myopia, astigmatic, or they are suffering of a disease called dry eye syndrome. In Ayurveda, we say this as Shushkakshipaka. Okay, or any sort of abhishandas, okay, any conjunctival changes, or shirashulas, or headache. These are called headaches. So what is the reason of this headache? Why the dosha is involved in this? Depending on that, we do a panchakarma called Shirodhara, and Nasya treatment is incorporated. Clubbing this therapy, we inculcate with Kriya Kalpas called Seka, Ashtotana, Tarpana, and Puttapakas.
Right. So I think a lot of that is available, at the treatments, and the combination and how to give, when to give, the time, to give is all depending, customized for a patient. Yes. Because I think that's again a very interesting concept where this is a treatment totally tailor-made to the person depending on the doshas and all of that, as you said, the causes. So the cause for my eye strain could be very different, and the cause for another person's eye strain could be very different. So I think again something, and that is the reason why Ayurveda can cure in a much more long-lasting way, because it is so specific to the person, and most of the aspects of that is taken care of. So quite interesting to know so many different treatments for this, and the approach that Ayurveda takes. So we'll love to hear one or two of your patient case studies, where what was the issue with the patient, what was the cause of it, and how you treat it. So maybe you can share one of your patients' case study with us.
Yeah. Before taking up this question, I'll tell you what is Shalakya. Okay. So Shalakya Tantra is one Ayurvedic branch. Okay, in the 8th branch, Ashtanga Ayurveda, what we say in 8th branch, it is one Shalakya Tantra, where it deals with eyes, ENT, skin and hair care, and dentures. Okay, so this disease, when we consider, eye has been explained beautifully in a separate concept called Netra Rogas. In that Netra Rogas, we treat all these diseases, no matter what are the causes associated with that, by inculcating Panchakarma and Kriya Kalpas. So these days, people are aware of Ayurveda ophthalmology. Earlier, it was not a thing because they were so unaware of the science itself. Now, these days, the branches are very much introduced to the millennials. So they come up with a history of usually eye strain, or else some foreign body sensation, or else blurry vision, sometimes terrible headaches with a gradual onset. So when they come up with this history, usually we take up with the eye evaluation. We'll examine the eye, we'll check their refraction, what is their visual acuity, and we'll examine their pressure, intraocular pressure, if it is needed. If at all they have eyeball pain or temple area pain, or they have radiating pain to the ear and all, we check the pressure also. And then we'll come to a conclusion, what is the disease they see. In my practice of 7 years of Ayurveda ophthalmology, we come up with lot of working professionals who are associated with IT industry and school-going children, where gadgets are more introduced in a learning phase or in home itself. So these two aspects of people, when they come and approach, we'll evaluate and we'll see what disease they are suffering. So usually there will be a dry eye syndrome, eye strain, because of visual acuity problems called refractive errors, especially in working profession, and in children we see with short sight, myopia, or some sort of astigmatism, and even they experience dryness, and they complain of amblyopia, because one eye is constantly visualized when they are not aware that they are having specs or the power, and it is not noticed by the parents nor the teachers. If the child is constantly visualizing these things, he may use one eye into more, and another eye goes into a laziness that is called amblyopia. So usually what we do is my practice is more towards dry eye syndrome or computer vision syndrome and refractive errors. So we one beautiful case study I want to tell about one client of 32 years age. He was working for IT industry, especially in the night shift. So his biological cycle was entirely changed. So he was constantly seeing the computer from 9 o'clock to 4 o'clock. So because of the work pressure, he couldn't able to have that break intermediate, and constantly he was fatigued. And he was not aware that it is because of his postural deformity and the dim light what he was using in home itself, because it was a work from home in a night shift. So the vision, he was having a blurriness of vision instantly. And when he came up with this history, I diagnosed this as a refractive error with dry eye syndrome. So then we started the Panchakarma treatment. His visual acuity, initially it was 6/36. One eye was 6/36, where he could able to read only 2. And another eye was 6/9, where just 5 lines he read. So yet he was not using the power because he was not aware. And one bad thing these new millennials, what they do is they just go to the pharmacist and they'll ask some OTC drops. Pharmacist doesn't know what is the cause of his history. Randomly he'll give some lubricants, or sometimes they try with antibiotics also, where it can harm their vision. And they try this, and they start with a headache. He started with a headache as a symptom. Then he came and approached, we evaluated, and we said, like, you need specs also. Initially, we'll put you on specs, and we start some eye treatments, then followed by eye exercise, where by doing these therapies, the vision can be brought to considerably, a reduction of vision can happen. And we do some therapy specific to the dry eyes, so called Tarpana. So we do this. So his vision improved drastically in 3 months. And he did constantly the eye exercise, and nutrition plays important role. So when we say about Ayurveda therapies, we incorporate nutrition also. What food has to be taken to improvise their vision. In this case, I had given moong dal. Moong dal contains zeaxanthin, which is very good eye tonic. And we tell them to use 2 teaspoons of desi ghee, and can do eye massage also. And lot of carrots, kiwi fruits, and walnuts, especially almonds and walnuts. So this will help to improvise their vision and maintain the power. And another thing is, it reduces the eye strain.
Right. So great, I think again, as you said, ki first identifying the reason for that, and then, actually treating it in a very holistic way, not only just the treatment, but ensuring that the food, the lifestyle, and the posture, so all of that is actually, combined and given as a treatment. And I always feel that it is the Indian system of medicine, or these are the therapies which people should know more about, because they treat you in such a holistic way that relapsing becomes it is reduced to a great extent, whereas with the other way we just keep subduing the symptoms when we look at the other modern medicine. So that's the whole effort that we also have taken up, that more and more people should get connected with great doctors like you, where they can actually solve the problem permanently. So thank you so much, ma'am. Thank you for your time, and it was really informative to understand how something which we treat as a very small thing, which is like an eye strain, can actually lead to a lot of complications, and a very unrest and an unhealthy life, which I think nobody would want to. So kind of detecting it in the earlier stage and improvising and actually getting it treated is very, very important. For people who are listening, you can consult Dr. Rajni. She's based out of Bangalore. All the details about how you can consult and book an appointment with her is given in the description. So you can, anytime you feel dry eyes or any other issues as well, you feel free to consult her online as well, and you can walk in to her clinic as well. So thank you so much, and we will again connect next week with another doctor with another health concern, and with beautiful therapies like Ayurveda and other Indian system of medicine. So thank you so much. Thank you, Dr. Rajni. Thank you.
Yeah.
Thank you.
Thank you.